I don't have pharmacy.
Okay.
Good evening, madam.
Good. Good evening, sir. Good evening, all.
Uh,
Yes, welcome to our favorite class, Wellness Wednesday.
Thank
Ah,
you.
you're welcome. All right. So, today is going to be a very exciting class because, especially because we've made it to the end of the year, and I want to use this opportunity in front of all of you to thank God for seeing us through. This is December. I cannot believe it's not too long ago I said Happy New Year, and now I'm already saying another Happy New Year before you close your eyes and open it. It went by very fast for me. I don't know about you. Um, so I want to talk about something very important because one thing I noticed, even in our clinic, because we have a lab in the facility, I noticed that many people do what they call annual comprehensive test. I see a lot of people do it towards the end of the year, and then some people do it in the beginning of the year. And so I was like, okay, you know what? Since many people are going to be running their lab tests around this period, maybe we should talk about labs and then what labs are all about, why we should do the labs. And even before I go to the presentation properly, I want to let you know that whether you know it or not, whether you know that it is there or not, does not mean it's not there. Let me say that again. So there are some people, even on this platform, until it hurts, until there's a need for admission, until it's too late, they don't check the labs. So I'm just praying that by the time I'm done today, we will all be very, very proactive and take a preventive approach towards our labs. More so, the labs that you normally get, because in the past, you go get a lab, the doctor will just write a prescription. There was nothing to talk about. So I'm going to use this opportunity to ask that when next you get your lab, you should pay attention and really, if you ask your doctor, doctor, please explain to me what is really going on. I want to understand this lab. They will do that. But sometimes they don't have the time. Um, in our clinic, we take the time to explain every single thing. That's why I know that if you ask your doctor, assuming you're not part of the doctor physically, they will also do that for you. Um, I have to mute all. Yes. Okay. So that being said, welcome to Wellness Wednesday. Once again, my name is Dr. Susanna. I'm your wellness friend. I'm, by God's grace, your health and wellness coach. We've been doing this actually consistently for going on 2 years. I just checked, I was doing my gratitude journal yesterday. What am I grateful to God for? And I realized since the beginning of this year to date, I don't think we have missed a Wellness Wednesday that we did not present. If we did, it cannot be up to one or two, and there must have been a real reason. So that has been the most consistent way from my own end that I've been able to reach out to this sickness-free body community. And I want to use this opportunity to say that if I was not encouraged, loved, and appreciated by you the way you do, I know that I wouldn't have lasted this long. So I want to let you know that your life can never, your health especially, cannot remain the same just for going through this year with me and learning so much. So, I mean, if you replace this with maybe network news or whatever, yes, you know what is going on in the country and the continent, maybe. But you know, which investment are you doing on your health to ensure that you're part of what the world has to offer? So I want to thank you so much, so much for going through this journey with me. And I hope it helped. I hope it made a difference. In the beginning of the year, we prayed for a sickness-free body. If you do not have admission this year, you should have so much to thank God for. Um, yes, I say that sickness-free body means here and there, disease can stop by, maybe small cold, small malaria, small headache. We live on earth, this thing will stop by. But when it stops by, it should exit as fast as it enters, even from just ordinary paracetamol, water, or sleeping. So if it enters and immediately it gets out, automatically then you have a sickness-free body because the thing does not want to stay in your body. But if it comes and it stays and lingers, then this is where we need to fight together to get you to a point where you have a sickness-free body. So I want to congratulate you and say happy December and happy new month. I think today is just the second or the third or the fourth or something. And we can progress into the presentation. Okay, so let me turn on the presentation and then I'll share my screen. And then we will just make this really quickly and then go from there. All righty. Okay. Hello, Mary. All right. Okay, so it says share your screen. I'm sharing it now. Okay, I think I'm sharing my screen now, so we can get going. Okay, so today's lecture, once again, my name is Dr. Susanna. This is my background, and on this platform, I come to you as a preventive medicine professional. I have a master's in preventive and promotional medicine, and also a lifestyle medicine professional because, as I often mention, when you go to the doctor's office, there are some things that don't make it down the prescription pad and those things are so critical to your complete healing. Things like peace of mind, maybe rest better, maybe see your water as medicine, maybe rest or you'll be rested, maybe um, exercise as medicine, maybe um, there are just some things that really should take 1 hour of explanation from a doctor, and then you now take a small tablet and then you're good to go. But the opposite is what is the case. You go to a doctor, before you say Jack Robinson, you walk out with a list of drugs, labs, scans, etc. But what got you sick is sometimes they are not addressed because, first of all, they don't have time, and also it's not even their profession. So that is why we come here to learn what is going to keep us well, what's going to make our medication work better, what is even going to get rid of the medication, what is going to help us prevent surgery, etc. So that is why we are here. It's a sickness-free body community. And as I said before, sickness-free body means, yes, here and there, small things can enter. Um, even age-related, I call it age-related wear and tear. So what is age-related wear and tear? That means with age, your prostate will enlarge. I always talk about my dad. Up to the age of 80, we did not hear anything. So I was like, oh, my dad is so healthy. He can never have prostate because he's drinking water. Once he was like 86, he went to do an examination. They say, oh, your prostate is beginning to enlarge. I was like, can't somebody escape this a prostate issue, you know. So, but to God be the glory, he's almost 90. So I'm like, okay, you know what? I'm sure some tablets will keep you long enough so you can enjoy the rest of your life. It happens. And when I say some tablets, like in the clinic, we have like natural things like prostate shrinkers, etc. But to God be the glory, he's doing okay. Um, Now, age-related wear and tear could be things like arthritis, waist pain, etc. So those things will come if you keep living on earth. So I want you to forgive yourself and then just keep checking early to get rid of them before they hurt you. So today's lecture is about know the hidden messages within your lab result. So because there are so many hidden messages that if you know those hidden messages, we some of us may never ever get to be on medication. So let's do it. So it says your lab results, okay, are the silent storyteller of your health. I started earlier by saying that whether you check to know or not, it doesn't remove it. So let's take hepatitis B, for example. You don't want to check whether you have hepatitis B. Whether you check or you don't check, it's still there and the viruses are growing. So is it not better we check early and catch the viruses when only just something minor can get rid of the hepatitis B versus wait until the cirrhosis, it can turn to cancer, liver cancer, then you now have jaundice, etc. So just don't forget it. Whether you check or not does not eliminate what is growing in the body. Okay. All right. So better you check and get rid of it. Okay. All right. Now, the labs speak long before symptoms appear. Okay. It speaks long before symptoms appear. So I'll show you something in a minute. The lab, memorize that the lab speak before the symptoms appear. For example, take prostate health, for example, okay? The lab you can just come into the clinic, like we had a client who came into the clinic and he had prostate issues a long time ago, and they actually did a surgery. It was a prostate cancer. They did a surgery for him. So any place he goes, once you want to check the prostate, it's like, no need to check the prostate because I already did a surgery. I now said, sir, in Dr. Fizik clinic, we do comprehensive lab tests. So we just have to check. Guess what? The PSA was 70, what was it, 79 or so? The guy said no. Do you know the next day he did not come back because he thought that we are just looking for reasons to pick numbers or whatever. It's so funny. In less than a week, he came back on his own. Oga, what happened? We did not see you for a long time. He said he had to go elsewhere and double check. And where he went to, the PSA is even showing 103, and another place is showing a similar number like us. So he decided to come back. So you can see that he didn't have symptoms. So he didn't have symptoms at PSA 70, almost 80, no symptoms. So that is why it's saying that these labs can speak long before symptoms appear. The real risk you cannot see, okay, such as inflammation, you cannot feel deficiency, you don't notice any warning signs, all of that, the lab can take care of it for you. Take cholesterol. There's somebody, I don't know if she's on the line, she told me she's nursing um, her uncle who died of, who got a stroke. The man was walking around, and one day he wanted to stand up from the chair and he just fell down. And now he's undergoing physio, struggling to get even his sitting up right and everything. Then, when he fell down and they took him to the hospital, they found out that he had the highest level of cholesterol and one or two other things. The question is, there was no symptom. So, whether you've done a lab test recently or you're planning to do one, This class will teach you how to decode what your lab values are truly saying. So sometimes when you finish doing the lab, the doctor will give you the lab result. I just want you to have an idea of what the lab is saying and sometimes what they are not saying. So you can win a battle for your health long before symptoms appear. I just give you two examples. A prostate cancer case, no symptom. A stroke case, no symptom, etc. We had a reverend father, a priest, who finished a gallon of honey within a month. And he was just not feeling okay. He ignored it. His body got better. Then it was end of the year, time for annual comprehensive test. Come to find out, sugar level was 27 or something. He was already diabetic and the HbA1c had gone crazy overnight. And the truth is that 6 months before or thereabout, HbA1c was like 4.9, like my own 4.9. But then he became, so you need to be checking. All right. Now, so the objective of this whole presentation is actually to equip you with the knowledge, skills to understand your lab. I am not trying to create a doctor out of you. I'm not trying to create in fact, it's wrong for you to try to interpret your lab. Why I'm even doing this is because in preventive medicine, or the type of medicine we practice, is called participatory medicine. Participatory means that you are participating in your healthcare. You just don't go and hand your healthcare to a doctor and say, fix me. No, you participate, you open your mouth, you talk, you get engaged. So you have no right to do a lab, interpret it, and go and get a prescription and maybe even perform surgery on your body. No, this is not the objective. And I have to be very clear. It's just for you to have maybe a better conversation. Maybe say, oh, doctor, I heard about this one. Did you check? Or doctor, like that. And more so to really understand the importance of lab and especially preventive medicine lab, such as an annual comprehensive lab test. So what is this lab test? Well, I took something from NCI, which says it's a medical procedure that involves testing your blood, urine, and other substances. Okay, so this is about blood tests. So the lab test can help determine a diagnosis, one. From the lab test, we can determine a treatment plan. From the lab test, we can see if the treatment is working or not. For those of you that are on cholesterol medication forever, did you know that if you go and double check and your cholesterol is so normal and even low, you can be on what they call a drug holiday? Because I noticed that many patients that come to our clinic, they're on cholesterol drug for life. I'm like, what of the kidney? And they're not even checking the liver. There's something called rhabdomyolysis and all these other side effects of being on certain drugs. They don't even check. So please check. Okay, now lab tests can help determine also, help monitor a disease over time. So why must you understand your lab result? Number one, for early warning sign, risk assessment. Look at this one, longevity indicator. Your lab can show you longevity indicators. So I will show you here too. Disease prevention, it can actually guide lifestyle and nutritional choices, etc. So unfortunately, many people do not understand the hidden messages within the labs, and that's why we said, let us come here today. And this can lead to serious complications and end up in a very expensive, get expensive to treat. So commonly ignored critical labs. So whenever in Nigeria, what I notice is that in the rural area where people don't have too much money and just managing their life, there's something called hemoglobin. They'll just check out, there's something called full blood count. Because the money is not complete and maybe insurance is not there, what do you expect them to do? They'll just check only hemoglobin. That's what they call it, hemoglobin. And then they just see, oh, you have anemia, like that. That's one. Then go higher, you see kidney, liver, etc. Kidney function test, liver function test. You see maybe prostate test. Those common labs that you've been doing. For example, if you're in the military, I am a consultant to the National Defense College. So I actually go as a speaker every year when they bring in the participant every year in NDC, National Defense College. I go to teach on preventive medicine. So one of the things I found out is that even the military, they cover your labs, but it's not, they don't pass where they're supposed to pass. And I found out that even when you go to a lab, you say, oh, I want to do comprehensive, there are some things that I want you to now pay attention to. Number one, there's something called CRP. Just be hearing, don't memorize it, but just it will come to you. There's something called CRP. That one is an inflammation indicator. Okay. Okay, there's something called homocysteine. Honestly, all the patients that have ever come to the Dr. Fizi clinic with their lab test, I've never seen homocysteine on their lab work. I've not seen it yet, except maybe they're coming from abroad. So homocysteine actually is an indicator of if you're going to have a stroke, heart attack, or even fertility risks. Nobody checks homocysteine. So, but everybody's falling stroke, stroke, stroke. Somebody asked me yesterday, why is this stroke so rampant? I said, it can be prevented. You can even check ahead of time. So between the C-reactive protein and the homocysteine, those two cells can even let you know that whether something is in the pipeline or not. Another test that is not commonly tested is vitamin D. Everybody is talking about vitamin D, taking vitamin D supplement, especially during COVID. They don't do vitamin D levels. So it's a little bit expensive. So automatically, most people will remove it. But this year, ask for your vitamin D levels. We learned on this platform, it has to do with your bone, immunity, everything. There's so much to do with vitamin D. And vitamin D is really not a vitamin in the body. It's actually under like a hormone. You can even check omega-3 index. Nobody does that in Nigeria. There's something called fasting insulin. No, they don't do insulin. In Nigeria, you will hear random blood tests. You will hear random blood tests. You hear HbA1c, and then fasting blood test. But there are other things like fasting insulin, oral glucose tolerance test, etc. I'm just mentioning these things so that you know that they exist, because how would you even know that this type of thing exists and go and ask your doctor? You won't even know. So I'm just telling you that these ones are not on your lab. Fasting insulin is not there. Which this fasting insulin, months to years, it can tell you ahead of time before you become a diabetic. Of course, the ferritin, unless maybe they see anemia or whatever, iron stores and inflammation is not common. Even a full thyroid panel, we do that in our clinic, but I don't see it in a lot of lab. Okay, so by the time they say you have thyroid issue, it's probably too late. Okay, so like the lipoprotein, which is the strongest cholesterol marker, I've never seen it on a Nigerian lab. No. PSA for men, I have seen CA125 for women. These are cancer markers. There's another called CEA. So I just want you to know in your head, when you go for annual comprehensive lab, with just a little extra money, maybe 50 to 100,000, it sounds like a lot, but let me tell you that it's cheaper than admission, it's cheaper than surgery, it's so much cheaper. Tell them, hey, doctor, did you add a cancer marker? Just know. Even if it says negative cancer, does not mean that there's no cancer in the body. I'm going to explain that part. But at least you have your peace of mind that at least you checked. But for those of you that don't even know that you can even check before, that if you have cancer in any part of your body, I want to use this opportunity to tell you that you can check ahead of time to see if you can, because cancer that catches you is usually very deadly. So it's better you catch it before before it will catch you. Now, apart from that, okay, let me talk about the abdominal area, the stomach area, right? So you come to the Dr. Physic clinic and we do the lab for you and you see that everything is looking okay, but you're not getting your body. Then we said, okay, go for ultras, like abdominal pelvic scan. And then when you go for the scan, we now find out you have fatty liver. Fatty liver can start the process of you becoming a diabetic in future. You can never have the same highest level energy that you're supposed to have. Fatty liver is like you carry your liver and you put in a nylon bag. It cannot breathe well. It's suffocated by fat. And that is why it's called fatty liver. So fatty liver, your liver is a filtration warehouse of your body, is a metabolism warehouse, is the toxin remover warehouse. If you put it inside nylon bag, how will it work? It cannot work. So now you've done your lab work. Lab says liver function, ALT, AST, GGT, all of those are all liver enzymes. I'm just reading them off my head. All those liver enzymes, they will check off that they're fine. But until you match it with a scan, you will not know that you've already started something called fatty liver. So that is why I'm begging you that when you go to do your annual comprehensive test, don't leave out the scan if you can. Okay, if you can, you must not do scan every month. You do it maybe once a year just to see how are my organs. Some of our clients, the liver function will be perfect, but when we go and check, they have enlarged liver. Then the liver function, I'm talking the blood work, even for prostate. I have seen prostate, the PSA is 2.5. The prostate size is already, the gland size is already at 70. I have seen it. So I want to ask that when you do your annual comprehensive test, back it up with a scan. Don't, because it's a scan that's going to give us the size of the organ, the texture, if something has started growing inside, if so these are some small secret messages that maybe you don't understand and you may feel like it's a small waste of money or even a waste of time. I know that almost everybody on this platform, when you do your blood work, you back it up with a scan. Yes, I'm so sure. But for those of you who don't do that, please do that and also encourage your friends. Remember, you're listening for 10 people. That is a commitment to come to this platform. Because if everybody here will have, if affect the life of just 10 in your network, we can together team up and change the world and decrease sickness. What is X-ray? Okay, X-ray, I'm sure you've heard of, or go and do a chest X-ray or whatever. It's still part of it. We all know what X-ray is. Even if you don't know it, at least COVID allowed everybody to know what is an X-ray. So basically, it's all, these are all imaging to get an image of, what is really going on. The CT scan is all a scan. There's no need for big names. MRI is a scan. Everybody knows the MRI. This mammography. So that is mammography is mammogram. So it's usually for women. You carry your breast, you put it in one machine. The machine will flatten your breast and scan inside of it and check if there's any lump, anything that resembles even the brother of cancer in the breast, even the sister of cancer in the breast. The MRI scan, the mammogram will actually, mammography will actually help you to pick that out. I think every woman should do it, even if it's every 2 years or 3 years. Let's not run away from it because you know what? You can touch all you want, but nothing beats image. Of course, the scans like the PET scan, echo, you always talk about ECG and echo, that's for the heart scan. Then we have this one. I've never seen anybody do this one in Nigeria. I'm sorry, bring the result to us. It's rare. This DEXA. So DEXA scan is actually your bone density scan. Yet, when people get older, they're talking about arthritis, back pain, knee pain. you can do a DEXA scan ahead of time. But I found out that these scans, that is why I said in the beginning, it is reserved for when it becomes very expensive. So don't wait till it becomes expensive. Do it ahead of time. So I wanted that everybody that is going to do, remember I said whether you check or not does not mean that what is there is not there. It's still waiting. Find out, and then thank God you don't have symptoms. It means God wants you to catch it before it catches you. So just to have in mind that when you do your blood work, one, you can add some fancy thing. Just say, hey, doctor, did you add something for inflammation? Please, there's something they say you can check if there's a stroke or heart attack in the pipeline. Doctor, did you check my vitamin D? Even the lab will give you one form to check off, but just, so that you can, when you're checking off what to pick, better you work with a medical doctor so that they can actually advise you on, if you have this type of conversation with your physician, they will now tell you what to go and pick. Okay, so as I said before, importance of the scans, early detection and early detection of disease and hidden abnormalities. It will help you diagnose internal injuries. So some people have internal injuries or internal injury, an organ problem. No, you won't even know. Take a colonoscopy, for example. We did a lecture on colon health. They go in, they study the length of your colon. Let me tell you, polyp, please, you can write this down. Polyps stay in your intestine, in your colon. It stays there for almost 10 years before it becomes a cancer. Now, if you caught it 5 years before, want to remove it and prevent a colon cancer? Me, I don't know one person who had colon cancer that is living today. All the persons I know that they say colon cancer, they die. Two cancers that I don't like them. This pancreatic cancer. I don't, even if you come to Dr. Physic now and say, oh, I have pancreatic cancer, I will first pray for you and ask you to go and do forgiveness of sin or whatever. Then we'll still do what we have to do. But if Steve Jobs did not get out of it, it's a tough one. Many people don't survive it. But a simple scan could have prevented that. And so without a scan, you may not be able to see that you have a pancreatic. In fact, you will not see that you have a pancreatic cancer. So it's important. Now, it helps diagnose internal injury. As I said, it guides the doctor during procedures and treatment. It monitors diseases, disease progression and treatment effectiveness. It detects cancers, tumors, polyps, fluid-filled things in your body. Things are always, this body is really unique. It confirms or rules out medical conditions, assesses pregnancy, fetal development. Scan is there. Please don't overdo it. If you're not sick, you should not touch anything called scan, maximum once a year. So I'm just saying that this is the end of the year. Between December and January, I'm begging everybody, do your annual comprehensive test, know how you are and how you're entering next year, so that way you can plan ahead. One of the lectures coming is called The Discipline of Wellness. I'm going to use all of this December to prepare us for January, so that once we enter January, in fact, we are going to do wellness care plan, so that once we enter January, you will write down your care plan for the year with your hand on one of these lectures between now and, so that way you see your care plan, and if you follow it, you have no business with a sickness body. So some of the things your lab results reveal, as I said, all this, one thing that you don't take very well in Nigeria is hormonal imbalance. Men don't have good erection. they don't have good erection after a certain age. Number one, maybe their prostates are enlarged. That is, it can affect it because the prostate shares the same pathway as the semen and the sperm. They all of them pass through the same place to go out through the urethra. So the point I'm making is that if you don't do a hormonal test to check, maybe it's not the prostate issue, it could be a very low testosterone level. Some people have zero testosterone level. Oh my God. And then you expect your body to be working as it's supposed to work. These are all age-related wear and tear. With age, the testosterone levels will come down. So then you beat up yourself. Some of our older clients or younger, they're on high blood pressure medication. That one already messes around with your libido. So, and you may be blaming the BP medicine, not knowing your testosterones are gone. So I want us to also tell them, I would like to know my hormonal profile. It's not a bad thing, okay? The vitamin levels, you can know your vitamin deficiencies, you can know your metabolic issues, aging markers, etc. So these are essential numbers to watch out for. As I said earlier, I don't want you to be a doctor, start self-diagnosing and prescribing. And no, I'm just opening your mind so that when you're sitting with your doctor, either when you're ordering the lab or during explanation of your lab, you can actually demand an explanation. You have better conversation. And as I said earlier, in Dr. Physique, we do participatory medicine. Participatory medicine means that, we always listen to your body. You're part of your health care. It's not blind medicine where you just give your lab, next thing you pick a prescription somewhere. That's not what we are talking about. So again, essential numbers. Fasting sugar, you check it. HbA1c, you don't have to remember, but I'm sure when it comes to remember, that one helps you check how has your sugar been performing in the past 3 months. Make sure your blood pressure is ideal, your lipid profile is okay. All this LDL, HDL, all of them are make sure your kidney is okay. Make sure your kidney filtration rates are okay. And your creatinine and albumin and the microalbumin, all of them that are okay. It's just some numbers. I don't want you to liver, AST, ALT. These are technical, in Dr. Physique training. We don't do too much technical things, but it's just in case there are people that have the ear for it. I'm rushing through it. Okay. Somebody said, oh, what is longevity indicator? There are some tests that tells you whether you live long or not live long. Here they are. CRP, HSCRP, okay? For example, if you have high cholesterol, very high cholesterol, and your CRP is normal, it's highly unlikely you're even going to have a stroke. But if you have medium to even almost normal cholesterol, but slightly high cholesterol, and your CRP is extremely high, you can get a stroke. So you can see that monitoring your CRP, maybe quarterly, every 6 months, just to check. Now, if you see the CRP is high, what are you going to do? Maybe you drink more green juice, maybe you exercise a little bit more, maybe your doctor will also let you know what to do. Definitely, if you do Oxivite, 3 Oxivite, your CRP goes back. So that one I am certain, because Oxivite on its own is anti-inflammatory. But then there are other normal things. You can start eating almond nuts, okay? You can do your moringa tea. You can do green tea in the morning. Definitely you can do turmeric tea. That is an anti-inflammatory tea as well. Garlic does not make you smell very well, but if you do a little bit, so the point is that if you see your CRP go up, you'll be like, I'm inflamed. If your CRP is up, all your arthritis, all these pains, they will come. Vitamin D. If your vitamin D is not optimal, it's a sign of short life. is a sign of short life. Just take it from me. So your vitamin D should always be optimal. Where are you going to go with health without a good immune system? Where are you going to go with health without proper bone health? All your blood, even the blood that is formed, is it not within your healthy bone or bone marrow? You understand? So it's so important. Please just make sure that your vitamin D, as much as you can, please ensure that it's optimal, because your body needs to be fighting for you. Low fasting insulin, please check it earlier, so if you have if your fasting insulin is not okay, once you have diabetes, you have everything else, because diabetes affects every organ. The ABCDs of diabetes, the ABCD of diabetes. A for what? Amputation. B, blindness. C, complications such as kidney issues, numbness and tingling. You cannot feel any, there's a lot of complications. Okay, that is C. D, death from diabetes. So nobody should have diabetes if you can prevent it. But sometimes diabetes is already there. So you just keep your numbers perfect and you're healthy. I know people who die at 106 and they had diabetes. I know someone who died at, 87. It's still a good number, diabetic. The mother of someone died at age 93, diabetic. So if you control your numbers, you will live long with diabetes. Or better yet, try to get rid of the diabetes. Okay, healthy lipids is also a longevity indicator. If your kidney is not filtering well, you will not live long. So a good GFR is a longevity indicator. And also good blood pressure is a longevity indicator. So these are some minor longevity. See, this longevity indicator is actually much more than this. So we'll do maybe a lecture strictly on longevity, so that you know what is in the first world for longevity. They're not talking at this level. We are talking gene expression. We are talking typing. Oh my God, this longevity has gone far. But at least for your annual comprehensive test, watch out for these indicators. Hidden issues, um, hidden issues even without symptoms, okay? Slightly raised liver enzyme. It might be fatty liver. Go and do the scan to double check. Mild high fasting insulin. You may already develop insulin resistance. Diabetes is in the pipeline. Low vitamin D level. Automatically, you have a weak immune system and you have a chronic disorder in the pipeline. Because now vitamin D, your immune system should be availed to be fighting things for you. Most people that died during COVID, they didn't die, is mostly people who the immune system was already battling other business. So when the COVID came, the soldiers were not complete. So they took over. Low magnesium. A lot of people are abusing magnesium now, so that's not very good. Okay. I talked about homocysteine. Homocysteine can let you know if you have a stroke, or there's a stroke in the pipeline, or if there's no stroke in the pipeline. So very important. All right. So this is December. We are going to do annual comprehensive between December, January. Or you can do it on your birthday, but try and do it now so that we know how we are all entering next year. So ask for all these things, okay? Follow-up and lifestyle modification. So abnormal lab results are often a signal to make a certain lifestyle modification. That is what we exist for, to prevent developing this disease. The funny thing is that even cancer, all these things can be detected. Yes, but it's okay. So once you see the markers, number one, jump on your dietary change. Today, I was having a conversation with a client, and I told the client that 99% of all the sickness we have in this Nigeria, 99, no, I think it's from what we put in our mouth. Because I feel bad to say it, but a typical Nigerian food, God bless us all. I'll tell you, over Maggi, I'm not talking the one in your house because this is a healthy community, so I'm sure things are different with us. But go to any like Mama Put or where everybody's eating or Maggi. In fact, one woman said she doesn't use salt in her food though. They said, why is your food so sweet? That she used Maggi straight, no salt. God have mercy. And if you see the line of people waiting for her own version of food, you know that she just buy one packet of Maggi, the one that is granulated, put it. That's the end. So why do you think liver and kidney problem is not all over the place? So if your lab is messed up, try dietary change. Today, I had a conversation with my dad, and I said, Daddy, do you know, no matter which disease you have, if you go 1 week on mostly green food, mostly green, maybe a little bit of fruit, in fact, you've already off this disease like halfway, your body will reset. So please try that. So obviously, that is when you see in January, everybody's going for a morning walk. Now you will not see anybody. Oh, just wait. January, everybody, pa, 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 because maybe they have done a test and they have seen something, one, or they want to start the year very well. Let me tell you, motivation is New Year. So I'll do New Year's resolution. Motivation doesn't last. Motivation is weak. I don't believe in motivation. You know what lasts forever? It's called discipline. And the definition of discipline, even a 5-year-old knows this, that is doing what you have to do, when you have to do it, whether you feel like it or not. That is the discipline. That is what works. I don't want to let the cat out of the bag because I have a lecture on discipline for wellness or wellness discipline because next year must be different for all of us. So it's not about, listening, getting motivated. No, we have to support it. Motivation is like the muscle. But let me tell you, if you don't have a solid bone structure to hang that muscle on, it will come crumbling. We are talking about if you do your labs, there's medication adherence and then regular monitoring. So that's pretty much what I have. I wanted to, no, there's something big. Hold on, that I want to use and conclude. And just before I conclude, it's just a friendly reminder that we are on a health journey. You've tried this I know people that from January till December, they have not missed this lecture, and I commend you. And I'm also sure in my heart of heart, your health has not remained the same. I commend you. But I know that I've repeated this so many times and I probably sound like a broken record. You know, in those olden days, when the record is broken, it will be said, thank you, thank you, thank you. Then you say, oh, go and shift the pin. Trust me, now I've given up my age that I'm very, very old now. So if you don't cannot relate to that, then you're not, you're still a baby, maybe. So I sound like a broken record, but please re-own your health. Re-own. Own. OWN. Maybe with ED. Yes, definitely with ED. Re-owned. Re-own your health. Please. Because how are you going to enjoy your body without health? How are you even going to do all that God has put you on this earth to do without your health? How are you going to actualize your highest, truest potential without your health? Even in the Holy Book, it says, above all health, above all else, above all else. I wish that you be in health. Well, I usually shorten it for health and wealth. That's the summary so that we don't cut our tongue. But that health is so important, and we have a duty. So we can't sit and do nothing and wait until it scatters. Then you say, oh, doctor, you will start being that doctor today. So re-own your health means R-E is rest, and then the energy. We're talking rest as medicine. I say it all the time, rest or be rested. Listen to your body. If you listen to your body, it will tell you what it needs. Forget even Dr. Susan said drink turmeric. If you put the turmeric in your mouth, it's not working, don't drink it. Your body is the biggest communicator of your health, not even your doctor. Even when you go to doctor, she doctor will say, so what happened? Why can't the doctor just look at you and know? They must collect word from your mouth. So use this. I said rest, energy, pay attention to your energy, your spiritual energy, your environmental energy, your systemic and even your cellular energy. Okay? That's re-own your health. Own, O-W-N. This is the foundation of life. This own, O-W-N. If you don't own your health, then you've own something else. O for oxygen. Something as simple as, okay, somebody has a stroke. All of a sudden, they're doing deep breathing exercises. So why didn't they do before now? So when you're running, you go, you're getting in maximum oxygen. If you take your blood sample that time, it's bright red. But if you don't exercise, it's dull, one brownish. I've even seen black blood. If that blood is that black, why wouldn't the person be so sick? So oxygen as medicine, O for oxygen, W for water, N for nutrition, own. If you pay attention to even only these three, you're already halfway there. Oxygen, water, try and do 6 before 6, even if it's 4, but just try. And then nutrition. What is nutrition? We are saying that raw food, God has put all the medicine on earth to heal you. But let me tell you, when you process it, fry it, overcook it, even if it's you run away from that kind of situation. The medicine will evaporate, will just disappear. So better we go back to things of nature. E for exercise and D for detoxification. We've done a lecture on detox. Our body can no longer handle the toxins that we are bombarded with on daily basis. So this one was just as a friendly reminder. So in conclusion, first one is that your lab results are more than just numbers. They are your body's health map. Are you kidding? If you don't know the map of where you're going to, then you know, where are you going without health? When you understand them, you can, one, prevent illness. You can prevent illness. You can protect your future. As we always say, when God says we go is when we go. We cannot negotiate that. But why must somebody go from a wheelchair or from, for just something that could have been prevented? Yes, there are some situations that cannot be prevented. Maybe an accident, maybe this, that. But largely, there's so many disease and medical conditions that we can prevent. Protect your future. Live healthier and longer. Know your numbers. Protect your health. And that's about it. So the reason for this lecture, once again, is that this is end of the year. Everybody, please do your annual comprehensive lab test, and then be healthy and be ready for next year. So that is that. Thank you so much for your time. I'll take your questions. I'm seeing some things here on the chat. So before
Good
you
evening, doctor.
Yes, sir.
Good evening, ma'am.
Hello, sir.
Okay, so last week someone asked a question that about concerning the noise coming from his neighbor, and he was asking the solution, but we were unable to You told him that you had no answer for that.
Yes.
You didn't know the answer. Now, I had the exact same experience.
Oh.
And there was something that I did that took care of the situation. And I actually know the brother that asked the question. So if it is allowed, I know that this platform is not a religious platform because not everybody is a Christian. There are Muslims, there are people that don't believe or anything at all. So, but if it is allowed by you, I can
Yes, sir.
share the experience. But if otherwise is the case, I will just drop my number so that he can call me anytime later so that we can speak over the phone. So
Is it a short one? Maybe others can
it's
benefit from it.
okay. It's just about one's faith in Jesus Christ and what he's able to do in a situation like this. That was what I actually did, and I got he did it. He resolved the issue without any crisis. So can I
Okay.
go ahead and share?
Yes, you can. Two things. The first one
Okay.
is you've already answered the question.
All right.
You've answered it. And that question, and the answer is that there's a part of our lecture here that says the God factor.
All right.
The God factor, yeah, sure. I'll just take one or two questions and then I'm coming. This is a place called the God factor. And if you lean on God, definitely we all know here that even mountains can be moved, right?
Sure.
So
Sure.
I don't know, maybe you ask the house if you can share. This is you people's platform. I personally don't mind, but I don't know how the house feels about it. So, but I think
Okay.
you can go ahead. Go ahead.
Okay.
But make it very
Brother,
short.
I want to mention the brother's name to be sure he's still here so that he can benefit.
Okay, so
And
find
then
out whether he's even here because that is the most important.
okay, then I will introduce myself so that he will know who is speaking.
Okay, sir.
Engineer Dennis Iyasele, are you online, please? Engineer Dennis Iyasele, I saw your name as a participant.
Oh, okay.
Hello, Engineer Dennis.
I'm sure obviously he will hear.
Okay. Now there are 5 steps that I took that solved the issue. Number 1, you must ensure that all peaceful options are exhausted regarding the matter. Every process that has to do with peaceful resolution, you must pursue all of the options available, whatever it takes. Then secondly, establish the fact that you are living in your legally acquired property that you do before God while you are presenting, because this is like presenting your petition before God. Now, establish the fact that you are living in your legally acquired property before God. Number 3, state clearly and specifically what that person has done or is doing and the adverse effects that thing is having on you and your family. That's number 3. You may state it clearly before the Lord. Number 4, state every effort that you and or others have made to peacefully address the matter and how the offender has refused all the peaceful steps taken to address the issue. That's number 4. Now, why do you have to do all this? Is it that God did not know when all these things were happening? Of course he knew. But now you are building a case before the judge of the universe. And for him to enter judgment in your favor, you need to establish your right standing in this matter. But more importantly, make sure that you are in right standing with him as an individual yourself. Now, having done all these 4 things, you can now present your requests to him. That is what you want him to do regarding the matter. And in this case of Mr. Engineer Delis now, there are 2 options that came that are available for to ask, to request from God. Number one, you ask him after presenting your petition before him, just like a lawyer standing before the judge of a court. You marshal out your points and then you make your request. The first thing to ask for is for God to cause the offender, to stop that noise, whichever way he decides to do it. It doesn't concern you. God is sovereign, and he can choose to do anything he likes and anyhow. So you can decide to ask him to cause the offender to stop that noise and leave him to do it his own way and at his own time. Then the second option is asking him, requesting from him to relocate the offender. He can orchestrate anything to cause that person to relocate. Now, I will give you the experience that I had myself. In my own case. Okay. In my own case,
the line now.
I think
in my own case,
I think the man should discuss with this man.
I think it will be better demand. I think it will be better demand.
Yes.
Discuss with this man directly and leave us out of this.
Okay.
Long,
I totally.
Let him take his number and then they can.
Yeah, they talk it together.
Yes. Okay. I think
I tried to reach him with an Airtel number of his that I had, but he was constantly saying switched off. But if I can drop my number here so that he can use it and call me, I don't know if he's
well done. You have done well. Thank you.
Yes, actually, honestly, I really appreciate your systematic approach to getting, in fact, anything. It's not only the fact that you build a house and then somebody comes to build another house and cause noise pollution that will shorten your life. I think what you have described, we can use it for anything. So thank you so much for being so systematic. And, if you have a health matter, for me, I think you can present it the same way to God and everything. There's something I always say, the God factor, there's just some things that miraculously can happen. So, sir, thank you so much for caring this much for that person. God bless you. And then, so maybe we reach out to the person directly. Glory, please help me get the man's number and connect the two of them. Thank you so much. Okay. Yes. Thank you. Yes, go ahead.
Doctor, please. One thing I want to ask first. I think I correct. I had it correct. If somebody is taking up prostate operation. Prostate operation. Yes, they had operation.
Yes. Yeah.
How do they pay that? I think there's something they cut off. Now they call it something. The PSA to grow. This one is another question I want to have also is that
discuss with Suzanne now. This one
is this comprehensive you showed us now. Many of us will not even remember some of these things. Because what I saw is so long.
To go to bed.
So why is it that if I come for a comprehensive test, maybe in your clinic, they should be able to do all those things without me naming them, because I came for comprehensive tests. Because most of these things I don't have their names. I don't even remember themselves. There are so many. So I think if I come for a comprehensive test in your lab, they should just do the whole thing. By charging me the money if I can afford it. Because for me to be naming them, do this one for me, do this one for me. Some of us are not medically inclined as you are. We are not as medically qualified as you are.
Inclined. That's true, sure.
Once I come to your clinic, to Dr. Lee, I say comprehensive test.
Advice.
They give
me advice.
And I do.
Okay.
But some other people, some other things you're mentioning now, I may not. Some of us don't even have idea of it.
Okay. So let me quickly respond to that. Well, there are two questions you asked. The first one is that if someone has done a prostate surgery, where did the PSA, where did it come from? the truth of the matter is that depends on the type of prostate surgery that they did. It may not affect you directly, but listen for you and your friend and your family, because somehow almost every man will run into a prostate issue at some point in their life. So depending on the type of surgery, there could be maybe, for example, the cancer cells or those cancer cells, for example, if the person had a prostate cancer, could be hidden somewhere, and then even though they have removed from this part, then they come back again and try to attack the same organ that they're used to, especially if they're not completely wiped. Because most doctors, they don't completely wipe, they just, take out the part that it is affected. So that is not one way. And then if you now some after the surgery, sometimes I notice that some neurologists will give you a medication, and then after a while you stop the medication. For some people, the period that you took that medication may be enough to wipe off everything else that was in the body. Even after surgery, you're given medication. But sometimes, depending on the person's body, it may just be like, okay, I have heard you. Then those small things that were remaining like demons will come back and regroup and attack the body. So what am I saying in essence? Don't worry about why is it that after surgery, because I see it all the time in our clinic, it happens. Just all I want you to walk away with is that every year, whether I have removed my prostate or not, I will still check my prostate health. That's all. It's not your concern where it is coming from or this and that. Of course, you do your part, but just check, because I have been surprised. There's some surgery where they totally removed the whole thing. I don't know where they came from, but sometimes it just happens. The body is really weird. Some of those cells may have been hidden anywhere. And then what is PSA? Is prostate specific antigen. It's a marker. Do you understand? That shows that, okay, you know what? Something could be wrong. But when we now do the scan or maybe examination, we now find out that something is actually still there. 2, I have a client, PSA has never been less than 50. Never been less than 50, but the prostate is tiny like this. I can't even imagine. So the body is unique. And then we also have somebody who has such a huge prostate gland and the PSA is still 2.8. So you have to marry, like when you're talking of prostate health, we do like 3 things. There's something called digital rectal examination. That's why they put the hand in the rectum and be doing like this, that because you can feel the prostate right from the anus. So it's not that somebody wants to touch what they don't want to touch, or what they want to touch, but it's just that what they need to touch is that they need to know whether something is sticking out. Is it rough? Is it smooth? Blah, 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 blah. You add that one. You do your PSA test. You add it, and then you still do a scan. Then you can now say, I have something. Okay? So I don't know how.
What I'm talking about is when we do prostate, they say prostate enlargement. That small thing that is enlarges, and if it enlarges, and then when it's too much, you go and block where you piece the urine they come out. And then somebody said that somebody got enlarged and went to do operation.
Yes.
Entire. They removed the prostate entire. That's very something.
Yes.
No, if you have enough, you leave it for me. I'll just go do it in the office.
Go to enlargement, they want to move it.
What are the big ones? It's full of bounty also now. Those 3 big ones, they have a lot of bounties inside. You know that.
If it's removed, if it's removed, that's very something removed, and
you can take it, no problem. This one should be enough for me. No, are there 2?
Don't talk
that is, I've answered
the only one now. You know what I'm missing?
Hold on. What I'm trying to say here, hang on 1 second. What I'm trying to say here is that the doctor will tell you they have removed. The patient will not know which style did they use to remove. I don't know if you understand. So to the patient, they have removed all. But there may be small benign tissue that was remaining that can grow back. There are many reasons. There could be, maybe if it was a cancer cell, there are some that escaped and then come back. Do you understand? So take it from me. There are too many patients that have come to the clinic. The prostate was once enlarged. They wiped them completely, and for some weird reason, it comes back again. So the take home, okay, is that just be checking early enough and then make sure that it doesn't catch you like it caught the man that came to the clinic. That's just all I can tell you for now. Then secondly, I think you had a second question. What was the second question again? Hang on, I wrote it. You say that all these lab tests that I am mentioning, how would you know the name? What I can do is I will put it on this platform. Tests that are not commonly ordered in Nigeria that you could improve. I'll screenshot it and I'll put it on this platform. I think that will be fair. So, or we will just design a comprehensive lab test that we think is a little bit above average, put it here so that if you meet any of your doctors or anybody that you want to do the lab, you can actually give that lab order to the person. So I think we can do that for this platform, so that way new things that normally you wouldn't have ordered, like homocysteine level, or maybe the complete thyroid panel, or maybe the cancer markers and all of that. We will list them out. We'll put it on this platform so that way, and that's why I said that I repeated all the time. I'm not trying to create a doctor out of anybody. No, you still have to go to the physician and get it done the right way. But the whole idea is so that you know that there's more to whatever you have been hearing, and then also to ask for more and then maybe have a better conversation. So I'll put it on the platform because I'm so sure many people will not remember or even be able to pronounce some of the names. I'll answer some questions on this platform. It says, let us have the description of your clinic. I don't know what that means. Glory, if you're there, you can put the address of the clinic. The clinic is we have in Lagos and we have in Abuja. And it's in Abuja, we have a full-blown diagnostic center. It's like a hospital, but we always use things of nature to treat. So we do oxivite, detox, but it's all medically guided. So that's the description of our clinic. So whatever you can use drugs for the rest of your life to treat, we try to maybe filter the blood and do things a little bit differently than the conventional drugs. Yes, because everybody, there's a medical doctor, a pharmacist, and a nurse. If there's need for drugs, you will still be put on drugs because everybody's a licensed medical professional. However, we now know how to marry natural approach without interaction, and then to get better and faster result. So that's the description of the clinic. Do you do HMO? Yes, we do. Doctor, thank you for this letter. Just to confirm, I did a lower endoscopy a few months ago, and a polyp was seen and immediately removed. From the information I got, most people with colon cancer die afterwards. I did not have any sign. So if you had a polyp, the polyp has to be taken to the lab. Then once you get to the lab, they will do a study on the polyp. And then if the polyp now comes out as a cancer, then they'll know that is a cancer started. But most of the time, polyps are just polyps, benign. You remove it so that the cancer doesn't come. Removal of polyp does not mean that you have colon cancer. So I want that to be very clear. Removal of polyp does not mean that you have colon cancer. How often should somebody undergo an X-ray check? I don't like all the scanning myself, so maximum maybe once a year. once a year is okay. Except you have a existing medical condition that we need to keep checking, then you will be told by a doctor. But on your own, if it is just a preventive medicine approach, which is what we are doing here, then you can do it once a year. Is it advisable to undergo X-ray check multiple times in a year? No, it is not. Dr. Susan, thank you for your lecture. I will get across to Brother Allison. Please do. God bless you. Dr. Susan, people who pollute food ingredients in the country are responsible for the rising death. My dear, I cannot talk again. So it's unfortunate, but it happens. So that being said, I don't know if you have any other comment or question. I just want to wish you a fantastic end of the year. I also want to ask that no matter the tiny effort that you make towards your health, you may not see it because you're already mostly healthy, but I want to assure you that it counts for something. Maybe a day that you drank water accurately, it counts for something. A day that you slept well at night, it counts for something. You're like me, I'm already well, so I take a very expensive multivitamin. I will not feel the effect because I'm well. But if I were bedridden or very sick and I took that, like somebody came to a clinic in coma, all these Oxyvite and cell regenerator and stuff that we give, that people just do, we saw it resurrect, bring up somebody that they send the person from one hospital home to go and die, and it brought the person back to life. So that is why I want to ask you that no matter what you're doing, you may not be able to see the effect, but it's counting. Okay, at least it's shortening how many days you would have been in a hospital, or maybe outrightly wiping off any disease. So let us just try our little best, and God will definitely do the rest for us. So do your annual comprehensive test wherever you are. If you're in Port Harcourt, do it in Port Harcourt. If you're in wherever you are, if you're in Abuja or Lagos, definitely you can do it with us, but it's not about doing with us. Wherever it is the nearest lab or the nearest medical doctor that you trust, do your annual comprehensive test and tell the doctor that you want to include a scan and then some of the things that I will put on this platform, and then just have a conversation. And lastly, if you do your lab and you feel that conversation is not deep enough, I can help you to go over your labs. Yes, like from next year, we are going to have a software that you feed in the lab and it brings out a functional medicine result. That means it will tell you things 5 years from now, 10 years from now, just from an application. So by God's grace, from January, we will be doing that. But whether we start doing that or not, go to your nearest doctor, do your end of the year, beginning of the year, because next year is a sickness-free year for all of us. So have a wonderful night, and God bless you, and God bless you, and God bless you. Take care. Thank you. See you next